other treatments that I give my patient based on understanding them. And I don't think the modern system really cares too much now about understanding people. The modern system is really mostly interested in figuring out what it is that somebody has in terms of what label we can give them. And then based on that, we just give a set of drugs. To me, how is that good medicine? I can't imagine someone says that this is a really good system of care. Because if you think about what a cardiologist does, for example, a cardiologist is meticulous. They are actually really interested in lifestyle. They're really interested in knowing about stress. And they do a very, very, very meticulous examination that might involve an EKG, an echocardiogram, maybe some even more advanced imaging. And then they really try to understand what is the best treatment that can actually biologically offset some of the pathological findings that they've been able to deduce from their very extensive evaluation. In psychiatry, that doesn't exist. There's no lab test, there's no objectivity. It's all based on somebody giving an opinion about another human being. So it's become a moral form of medicine. You're making a moral judgment on one person, and you're really not doing anything that's medical. So to me, I think it's not affording people with a precision that is needed. What I love about what I do is it's very difficult to run tests to really figure out all the roots of somebody's emotional suffering. At least I understand their suffering. At least I can understand how they're living. At least I can understand all of their strengths. And from that, I try to apply, as to the best of my knowledge and ability, what set of micronutrients and other treatments might help with their emotional regulation in a way that supports their strengths and reduces their deficits. But in mainstream psychiatry, it's all deficit-oriented, and it's all about disabling normal processes in the brain as a way to help somebody regain more functionality. And that is so oxymoronic when you think about it. It makes no sense. What drives me crazy is when you think about the brain, it's actually more complex than the universe itself. Our brain contains 150 trillion synaptic connections in the cerebral cortex. So our brain contains 150 trillion synaptic connections in the cerebral cortex alone. That's not even the whole brain. So we can't even begin to understand the roots of emotional suffering. At least at the end of the day, I can look myself in the eye, look myself in the mirror and feel good about the work I do, because I'm not going to at least impair brain processes and undermine somebody's capacity to live a good and robust life. But if you imagine that you know what the roots are of emotional suffering, which psychiatrists claim to know, they claim that they're treating people for biochemical imbalances. They're claiming that they're treating people who have impaired brain circuit abnormalities, but they're claiming something that simply isn't true. They do not know how the human brain works. No one does. Well, you know very, very small details about it because it is more complex than the universe itself. As a result, we should not be impairing the brain. We should be supporting the brain with things that we know support it, like micronutrition. There's no way drugs support the brain for psychiatric conditions like schizophrenia, like depression, like anxiety. All they do, as I've said before, is they de-intensify things. So at least, given the complexity of the brain, I know at the very least that I'm supporting its natural processes, even though I can't begin to understand just the sheer complexity of it. It is the most marvelous organ we have. It gives us thought, it gives us the ability to love, to have empathy, it gives us so much. And yet, there's a branch of medicine that claims to understand it and has sold that idea to the public. And they've actually received it hook, line, and sinker. They actually have embraced it as if a serotonin deficiency is responsible for all suffering. That is insane. There's probably some 100 or 200 neurotransmitters in the brain. It's not just serotonin, it's not just dopamine, it's not just norepinephrine. So the problem is our paradigm of care is only focusing on what it knows, but it knows in really crude detail. And we're actually putting people on very, very addictive medications under this sort of delusion that somehow we actually have figured out the brain. So we're selling an idea that just isn't true, and we're co-opting these people into actually embracing this idea as if it is true, and they're becoming consumers of drugs for the rest of their life, and they're not living well. I've met very few patients in over 16 years of clinical practice who are actually thriving in their life while being on psychiatric drugs. No doubt I've seen people who benefit from them. often for short-term reasons. And no doubt I've seen just the rare person who may benefit from these drugs long-term. But as a whole, it's very few and far between. Very few and far between. For the most part, I see patients who aren't thriving, aren't living a good life, and it's precisely because they've embraced this idea that psychiatrists somehow know something about the brain that the rest of us don't. In fact, no one knows. 150 trillion synaptic connections in the cerebral cortex alone. Tell me, how would you explain that? You can't. So all we can do is give things to people that are healthy, that support the brain, and let the brain do the marvelous thing that it does. We should not be disrupting the normal processes in the brain. That should not be our paradigm of care.